Born and raised in Jackson, 11/17/1968. Went to Jackson Academy, graduated high school there, went off to Tuscaloosa and did my undergraduate work at the University of Alabama. Big Crimson Tide football fan. Came back home to Jackson, went to medical school here at University Medical Center, where I also completed my residency in family practice in 1998. Met my wife during that time. We got married, I believe my first year of residency, and we live in Madison. Have been there ever since we got married, and this August will be 14 wonderful years. And we've got two wonderful children. Jake is 11, and he'll be in the 6th grade at Jackson Academy this year, and my little daughter Tori is 7, and she'll be in the 2nd grade at JA next year. You know, the gifts and talents that God gives you, I think He gives you direction as far as where He can best use you, and I felt like that would be in the area of in the area of medicine. I felt pretty called to that by my sophomore year at the University of Alabama. Went on into pre-med and had a lot of assistance from some college roommates who were already in pre-med, who kind of walked me through the ropes, because obviously that's a stressful time deciding what you want to do when you grow up, and really just kind of dove off head first into it, and really felt like that's where I needed to be, based on just my passions and just outgoing, gregarious personality. Love being with people, visiting with them, and taking care of them, and just feel great about family practice because it allows you to build those long-term, lasting relationships that really mutually benefit the patient and the doctor when it comes to seeing each other in the community at ball games, and growing up with your patients and seeing them through to retirement, and they seeing you through to your retirement. So I just love the field of family medicine because it allows you to build those long-term, lasting relationships that I think benefit the doctor probably more than the patient. As a family practice doctor, you could be dealing with a patient who's got out-of-control hypertension, chest pain, a wart on their finger, depression. Really, with our type of practice, we are more of a traditional family practice clinic, more so than an urgent care clinic, in the sense that we really like to take care of really everything going on with the patient, and with the understanding that certainly there are times we need to refer that patient to a specialist. So, all of your basic routine hypertension, diabetes, high cholesterol, congestive heart failure, and then all their urgent care needs, certainly we meet those needs for them as well, albeit we're not an urgent care clinic. We certainly will service those needs as well. But really there's not one specific area that I'd say I try to hone in on, because really you can't, because you got to take care of whatever's behind the door. But the ones I've mentioned are certainly the most common things that walk into the clinic. Well, I think patients are looking for several things from me as their primary care physician. Number one, certainly a kind, compassionate bedside manner, and if you don't have that, you're in trouble. If you don't bring that to the table, you're really going to have a hard time building that relationship. Number two, certainly competency, and just making sure the patient feels like you have a good authority about you when it comes to understanding their medical problem and communicating your ideas as to what could possibly be wrong with them as you're thinking them. And that's always been my philosophy, is to speak out loud, even during the physical examination when I'm not certain yet. I'm giving them my differential diagnosis, which is the top 3 or 4 things that maybe I think could be causing their abdominal pain. So I think certainly the bedside manner is huge. The competency issue and accessibility would be the third thing. And I think that's basically my primary philosophy in making sure that we meet not only their physical needs, but we understand that there are emotional and spiritual needs that are tied into those physical needs as well.